Good afternoon, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. This afternoon, I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
I'm doing quite well. Thank you, Katie.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answered your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, May 15th. We invite you to submit any questions or comments you have down below or at any of our social media linked in the description. Starting with that abbreviated COVID statistic, average COVID deaths per day in the last reported week were 47. The same week in 2024, we saw 71 daily COVID deaths. Dr. Murphy, your reactions to those numbers?
Well, we're at the end of the season for these respiratory infections and the ultimate consequences. So it's interesting. It's not the death rate is not going down any lower. The good news is it's lower than last year, but the difference is getting smaller and smaller and smaller. So it really remains to be seen. Are we at the bottom of this thing? Is it ever going to get any better than this? This is the only number we have to track, so we'll find out. We'll see also if we have another bump in August this year. There's always been this summer bump. So we'll see if that happens.
Absolutely. We will follow those trends. And a COVID-19 study that was just published showed a worrying trend, that about getting COVID during pregnancy. Can you tell us about those results?
Yeah, this is a very interesting study that is coming kind of late. But now we have all this collective data, and it's being analyzed left and right. So this is from a group from the University of Texas, published in BMC Medicine, which is a good journal. Women who got COVID before or during their pregnancies were 2 to 3 times more likely to miscarry before 20 weeks gestation. So it's a big study. They looked at 27,000 pregnant women who got evaluated. The numbers are really kind of surprisingly dramatic, including 17 women who died, with 5 due to any cause and 2 due to COVID complications at the time of childbirth. So if you do the multivariate modeling, which is kind of the strongest modeling, you find that the odds ratio, the risk of dying or having a miscarriage, the risk of having a miscarriage were basically 2.5 times greater if you had mild or moderate COVID. So that's a lot. Miscarriages happen. There's always complications with pregnancy, but they're generally a very low rate. But just having mild or moderate COVID increased 2.5 times, more than 2.5 times. So that is really it was surprising. And the authors quote, "These findings highlight the importance of COVID-19 vaccination and post-COVID management for pregnant women who are planning on and those who are planning on pregnancy." So it's just another thing to keep in mind.
Absolutely, and a very important finding for those who are expecting or who may be expecting in the future.
Mm-hmm.
And while we're thinking about kids, the flu season has come to mostly an end, very low transmission, but unfortunately, we're still seeing pediatric flu deaths. Can you tell us the new tally?
Yeah, there were an additional 10 pediatric flu deaths in the last few weeks, and that brings the total flu deaths in children up to 226, which is the highest number since 2009, 2010, which was the swine flu outbreak, where there were 288 pediatric deaths. Almost all of them, these children were unvaccinated. So, kids are much more at risk for certain infections. And it's the case here with the flu. And unfortunately, it can lead to death.
Absolutely. And that flu vaccine is recommended for everyone aged 6 months and older.
Months and
So
older.
something,
Exactly.
yeah, something to keep your eyes out when the next respiratory season rolls around. But
Yeah, it's one of the
something
few
that,
vaccines that's just recommended for everybody 6 months and older, no matter what.
absolutely. Now, something that has been a through line through the respiratory season and to now is the measles outbreak. Can you bring us up to date on what's going on here in the US as well as with our bordering countries?
Yeah, so the US has over 1,000 measles cases from 11 states, and including North Dakota, which reported their first case. 717 of these occurred in Texas alone. Nationwide, this 1,000 or so cases, 126 people ended up in the hospital, and 3 have died, including 2 kids and 1 adult. Almost all of the people are unvaccinated or the vaccination status is unknown. But it's being reported everywhere. New Mexico, Oklahoma, Kansas, Indiana, Michigan, Ohio, as I said, North Dakota. In North Dakota, where they had 12 cases confirmed, the outbreak led to the local officials quarantining 200 unvaccinated students. So they really jumped in to, try to protect these students because, as you can see, it's typically 2 to 3 people per 1,000 die, and that's exactly what has happened. So, we used to have millions of cases per year. So, that ended up with a lot of deaths. And it's unfortunately mostly in these children. But if you look around the country or our neighboring countries, one outbreak in Ontario, Canada, resulted in 1,400 cases. And in Chihuahua, Mexico, it's a Mexican state, they had also over 1,000 cases and 1 death reported as of last Friday. In the Mexico one is centered around another Mennonite community who traced it to an 8-year-old unvaccinated Mennonite boy who visited relatives in the Texas Mennonite community. And so that's how it spread. That's how this thing spreads. So just bringing up the importance of the measles vaccination is so important to prevent this.
Absolutely. As a reminder, 2 doses of that measles vaccine, the MMR vaccine, are 97% effective at preventing measles infection. So the best way to protect yourself and those around you
Oh,
from the
absolutely.
measles.
It's a old vaccine, over 50 years old. It's been around forever. And it's saved a lot of lives.
Now, shifting our view to Los Angeles here in the US, out in California, there has been a lingering of hepatitis A with higher than normal cases. Can you just remind us a little bit about hepatitis A and about the cases that are
Yeah,
ongoing?
hepatitis A is another. We know hepatitis B, which is sexually transmitted in blood. Hepatitis C, which is very also sexually transmitted, but mostly transmitted with sharing needles and blood products that aren't screened for hepatitis C. A is the one that's transmitted by human contact, eating contaminated food and being around people who have it. You can just get it. It starts very classically with fever, fatigue, nausea, loss of appetite, vomiting, diarrhea, and then you get, when the hepatitis really sets in, your skin gets yellow, their eyes get yellow, the urine turns dark, and the stool turns light. It's hard to study these because the incubation period is so long. People move around so much. You have to look back as far as 7 weeks. So severe symptoms are mostly seen in older adults and people with underlying diseases. And like I said, it rarely can be fatal. And these outbreaks that have been happening now, so 138 people in LA alone in 2024, 7 people have died. So yeah, it's a very unfortunate outbreak there, and they're trying to eradicate it.
Yeah, we will keep you up to date on that. So far, not a risk to the general public, but always good to keep on top of those things.
Mhm.
Looking globally now, we shift our attention to Mpox, which the outbreak luckily has settled down somewhat, but there are still cases rising in some parts of the world, especially now in Sierra Leone. Can you tell us about it?
Yeah, this is kind of unusual, strange, in that Sierra Leone is way in West Africa. And Congo, where this Mpox thing really started, the outbreak started anyway, is way over in Eastern Africa. I mean, they're nowhere near each other, you know. And they have now reporting 384 confirmed cases in a week, which is 50% of all the cases worldwide last week. And they have really limited medical facilities and only have 60 beds in hospitals that are set up to treat this. And they've got about 800 active cases. And so most of these people are just sent home. And it just shows you how these viral infections can spread around so much. Very,
Absolutely. And that is showing just how important that new freeze-dried Mpox vaccine can be, that it can be spread out so
right. Yeah.
quickly with
Now they've got to
fewer
move it all
storage.
over to West Africa. Yeah.
Yeah, absolutely. Now, our next and final story is on something that I actually had not heard of, but
Yeah.
there were 9 additional cases in Saudi Arabia of Middle East respiratory syndrome. Can you tell us what it is and about these cases?
Yeah. So this is typically called MERS, MERS, for Middle East Respiratory Syndrome, coronavirus. It's a coronavirus. Now, remember, coronavirus has been around for a long time, caused the common summer cold. And then we had SARS, the one that was transmitted a lot in hospitals. It was more difficult to transmit. About 10,000 people got it worldwide, but 10% died, a coronavirus. Then about 10 years later, we get MERS. It's in Saudi Arabia since 2012. It's still there. They only have 2,627 reported confirmed cases. So there's probably a lot more than that, but still, it's not a huge number. But again, this has a 35, 36% mortality rate. So, and they're still having these cases. They just got 9 more cases in reported out of the capital city of Riyadh. So, MERS is still out there and causing all sorts of trouble. Another coronavirus. That's a nasty player.
Absolutely. And when we hear coronavirus, of course, our internal alarm bells just start to go off after we're getting through this pandemic. So good to stay on top of these things. Know
Yeah,
that
I mean, I think we have to realize that, the research for coronaviruses has basically been shut down. Oh, COVID is over. We're not going to study anymore. Studying this coronavirus is no longer the pandemic. The pandemic is over. Well, the COVID-19 pandemic is over. All right. Well, it's going down. It's not over, but it's down to a dull roar. But these coronaviruses are nasty players. What's next? We had SARS, MERS, COVID-19. Is there more? It's really silly and short-sighted to shut down research on this family of viruses. These things are deadly.
absolutely. And, before 2019, certainly not on the general public's radar of a coronavirus. It could be that, it could be something totally different. So, like you said, very short-sighted to stop the
Very,
funding of those things.
very short-sighted. We were short-sighted at the beginning when we saw SARS and then we saw MERS and we didn't go after coronaviruses. That was a mistake. I think everyone agrees to that now. This is a family of virus that we have to take very seriously. And stopping work on this now, very short-sighted.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, breaking down the latest data and keeping us informed on all that's going on around the globe.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions or comments, please feel free to leave them below or at any of our social media linked in the description. We'll see you next week.